Aloha, and welcome back to the fifth episode of Talk Story with House Majority. My name is Della Belatti, and I serve as the House Majority Leader of the 30th State Legislature. We are in week 11 since the state stay-at-home orders were imposed on March 26, and at the yellow level of Act with Care. Next week, inter-island travel will begin and reopen without the 14-day quarantine. While state agencies are implementing a system of safeguards, beginning with thermal screening at the airports and health forms, our public health officials are working hard to strengthen contact tracing in anticipation of this increase in inter-island travel. Today, I will be joined by those leading the charge. We have Dr. Aimee Grace, who is the Director of Health Science Policy at UH, leading the contact tracing collaboration with the Department of Health, and a returning guest, Dr. Sarah Park, our state epidemiologist. Later, I'll be talking to Representative Tom Brower, chair of the House Committee on Housing, about short-term and long-term goals for his district of Waikiki. We'll also discuss the reconvening of the legislature on June 22nd. Be sure to comment with your questions for our guest on the live stream featured on facebook.com/Olelo community. So our first guest, welcome back, Dr. Park.
Thanks.
My very next question with inter-island travel on everybody's mind. What can a resident traveling inter-island expect to experience when traveling between our islands to visit friends and family, to go holo holo, as we like to do here in the island?
Yeah, so starting on June 16th, next Tuesday, everyone who's traveling inter-island will not be subject to the 14-day quarantine, assuming you're one of our residents and you're not coming from out of state, right? I have to make sure everyone realizes so we don't have someone from California coming in and thinking they can travel inter-island. It's only for us, Kamaina, we can travel inter-island starting next Tuesday. The only thing, though, is that we want to make sure we monitor closely for obviously any potential concerns, and we want to protect Hawaii, right? So that means implementing a new travel health form, and that will ask a few details about your contact information, where you're staying, things like this, but also some questions similar to what you might see in a doctor's office. When you go to your doctor's office, a lot of times you get handed a clipboard and they say, check off yes, no, do you have these symptoms or issues, right? And so it's a very simple, short symptom checklist, essentially, a question about whether you've had flu vaccination, and that's pretty much it. And then that would be handed off to a screener, or the temperature screener, and they'll take your temperature, and then depending upon how things go, you may be directed to a secondary screen, for example, if you have a fever. But if you don't and you're healthy, you get to keep going on, and hopefully everyone gets to enjoy visiting each other like we used to. That's pretty much it.
And the other levels of kind of screening will be the thermal screening at the airport when you depart, and as also when you arrive. Is that both going to happen?
So just for the inter-island part of the travel for this period of time, the screening is only happening as you depart. For people arriving from the mainland or for international, still, believe it or not, there's still some travelers. They're being subject to the thermal screen or temperature screen when they arrive. Somewhere down the road, it'll all be arriving passengers, no matter what, right? But it won't be, inter-island screening won't be part of it. This is actually where we as a community can work together to help sort of work out the kinks of this system, because the hope is that this method of health screening will continue with arriving passengers when down the road we may be able to open up. And I want to just also say the governor is going to talk in much, much more detail about this at his 2:30 press conference. So please tune in to the governor then.
Okay, so now what I'd like to do is, so we have the thermal screening, we have the health form. Now we really get to the meat of it, the contact tracing. And I'd like to play for our visitors a clip from the University of Hawaii and the Department of Health showing the kind of interaction that will occur between contact tracers and someone who may be COVID-19 positive. So this is a role play of what could happen if a contact tracer were to call you. Take it away, Olelo.
Hello?
Hello, is this Mr. Jared Young?
Yes, it is.
Hello, Mr. Young. This is Michelle Bray calling from the Department of Health.
Oh, hi.
Hi, good morning. How are you doing today?
I'm fine.
Good to hear. I'm calling today to talk a little bit about the COVID-19 coronavirus. Can you verify your date of birth for me, please?
It's January 6th, 1975.
Thank you very much. Is this a good time to talk, by the way?
Yeah.
Alrighty. So as a part of an investigation into a case of COVID-19, we are following up with individuals who was a close contact with the case while they were possibly contagious. So I'm calling to check on you and discuss some public health recommendations.
Sure.
So right now, we know that you may have been exposed to COVID-19. We'd like to collect additional information to understand your risk.
Sure. Whatever needs to be done.
Thank you. So have you been feeling good? Can you tell me how you're feeling right now?
Right now, I feel fine. I feel normal.
Any fever?
No.
How about shortness of breath?
No.
Cough?
Coughing? No.
Very good to hear. Well, since you have been exposed to someone with COVID-19, what that means is that we'll need to have you in quarantine for 14 days.
14 days?
Yes, 14 days. So this means that you will need to stay in your home for the next 14 days because you were exposed to someone. Is there someone, a family member or a friend that can provide you with food or medications while you're in quarantine for those 14 days?
Yeah, no, I have my family, my friends. I can do this.
That's good to hear. We'll also provide daily monitoring.
Okay.
So we'll have someone that will call you on a daily basis to see if you develop any symptoms. And also a letter will be sent to you based on the quarantine instructions.
Oh, yes. All right.
Do you have any questions at this point?
Well, not off the top of my head, but no, I can do this.
And we will be calling you on a daily basis. So if you do have any questions, the person that calls you can go over your information with you and address any questions you have.
Great. Thank you for that.
Now, I do have specific questions that I need to ask you based on our COVID forms that I need to fill out. So do you have some time at this point to go over some information with me?
Yeah, no, absolutely. Fire away.
Alrighty. So the first question I'd like to ask you is, what is your occupation?
I'm a teacher.
A teacher. Thank you.
So what seems like a pretty simple interaction on the part of a contact tracer really does require a lot of skill. It requires health knowledge. It requires empathy of the caller, and it also requires attention to detail and understanding of the health system's process. So that's where our next guest, Dr. Aimee Grace, comes in. She's with the University of Hawaii, and she's really helping to administer the program that will bring and raise up the number of contact tracers we will have in the state of Hawaii. Aimee, Dr. Grace, welcome to Talk Story with House Majority. Can you share with us the role UH is playing in training contact tracers that we're going to need in the future?
Sure, and thank you so much, Majority Leader, for having me on the show. It's really an honor to be here and with Dr. Sarah Park, with whom we've been working closely on this DOH-UH contact tracing training program. We're really excited to be rolling out the program. Actually, our first cohort just started on Monday of this week. There are 3 different arms. We have a first track to train those with health professional backgrounds, so those with clinical backgrounds. We also have a track that would train those that have undergraduate degrees but may not have clinical backgrounds. We also have an arm of the program that will train up more community health workers. What I want to emphasize is that together, all of these arms of the program will help to create a robust surge capacity if the state needs it. So it really is going to be up to the Department of Health, and according to how many cases we have, about whether any of this trained workforce will be hired. But we really want to make sure that we have trained them and that we want to make sure we have a statewide workforce. So we've been really pleased to have a lot of interest from those on the neighbor islands as well, because our programs are delivered online. And so we're excited to be able to represent the full state as much as we can in these training programs.
So in the news, we always hear numbers of contact tracers that are going to be needed. Can you break down how many we're going to be training by each track?
Yeah, sure. So our target is for 320 to be trained by track 1, which is the clinical health professionals arm. We actually think we may get closer to 375 in that track. Track 2, we're aiming to train 250 contact tracers over the next year. And the community health worker arm of the program, we aim to train 100 community health workers across the UH system over the next year.
So I want to come back to the community health workers in a little bit, but I don't want to forget about the contact tracing trainers. You're saying about 300 by the middle of this year or mid-July. Who's going to be doing the training for that?
Sure. So track 1 is being led by Dr. Christine Qureshi, who's our Associate Dean in the School of Nursing and Dental Hygiene at UH Manoa. I want to emphasize again that these programs are online. So while Dr. Qureshi and her team are leading the charge, it's available to anyone, regardless. Definitely don't need to have a UH affiliation, and definitely, again, statewide. And again, that program is a 1.5-day training for those who already have clinical backgrounds. And the reason is for that is because, as you saw in the video, it's really important to make sure you have empathy and maturity and a lot of those clinical skills that our clinical professionals already have. And hence, they're able to take an accelerated program. So track 2 is a 6-week training.
Go ahead. Sorry. Go ahead.
Yeah,
talk about 6-week training.
And that's led by Dr. Rick Custodio at UH West Oahu. Again, another online program. But there's 2 courses there that will really cover a lot of the details to get folks up to speed, even if they don't have clinical backgrounds, about motivational interviewing, crisis counseling, connecting families with resources, all of those key clinical skills that we think are really necessary for contact tracers. And then that will complete with the 1.5-day training like the track 1 folks received.
Now, so really great. We're going to have maybe 500 people capacity if we need to surge from outside of the Department of Health for contact tracers, if there's clusters, as we see more travel beginning. Talk to me about the community health workers, because that is a really exciting part of the program that is actually an opportunity for folks to really maybe perhaps look for a career ladder step. Can you talk about that?
Absolutely. We're thrilled about that aspect of the program. And I really credit Dr. Park with her vision and really seeing the importance of community health workers in our communities. You know, the contact tracers do a lot of their work from the phone, right? But we need people who are connected in the communities, who are trusted in the communities, who may come from those communities and also may speak the language of those communities that are most impacted or high risk. And so this program will really allow us to expand our training capacity so that we can graduate, again, 100 community health workers over the next year who can then be employed as needed, whether it's by the Department of Health or federally qualified health centers or the counties or others that can really use their services to serve as liaisons between our health systems and the community.
So you know what, this is a perfect time to cut to Dr. Park and bring her into the conversation. Dr. Park, what is for you as the epidemiologist of the state so unique and promising about the community health worker program?
I think over and over again in our investigations, and not just with COVID, I mean, we saw it with mumps, we've seen it with hepatitis A, we've seen it with so many other outbreaks and just day-to-day investigations. There are parts of our community where we do struggle to reach them appropriately in terms of providing good education. A lot of times when we provide that education on how to protect themselves and protect the rest of the community from spread, you know, they have challenges in terms of socioeconomic challenges, other challenges. There are language barriers, cultural barriers as well to get people to understand, you know, to what to us in the American culture might seem logical, and another culture doesn't really make sense with how they, you know, how they normally interact with each other. They may be more communal than we are. Just so many different things and different perspectives, essentially. And that's where working with people such as community health workers who are really vested in the community, oftentimes speak the language, are even from the cultures that we're trying to reach, are really, really valuable in trying to have an effective sort of outreach towards preventing further spread of the disease. So it's really, really critical to have these types of persons, not just employed by Department of Health, by the way, but also healthcare systems, other folks really to, like, as Dr. Grace has said, to really connect up our healthcare systems and the community.
So this is a huge benefit that's going to actually be coming out of this. I think we will see healthier communities within our most vulnerable communities, because I know that people are concerned that, say we were to start to see some positives in our homeless populations or our houseless populations, containing that will be very difficult. But if we can contact trace that immediately with these trusted community figures, we can really begin to contain. So Dr. Grace, how many people have signed up for training, and what's been the response to the call for training by UH?
Yeah, again, I want to reemphasize, as I have previously, I'm just so grateful for the community. We have had now almost 1,400 people sign up overall for this program. Very impressive. And I really want to thank our UH team and the DOH team who've been working around the clock to try to make sure we sort through all of these applications, put people in the right tracks, and get them started. Like we said, we already started this past Monday. So we've had a significant amount of interest for both the clinical track and for the folks who don't have a clinical background. And again, we're planning to train about 374 through track 1 by mid-July 2020. And then we have hundreds more that are interested in the track 2. But we're really trying to make sure that we have balanced classes. And again, that we make sure we have neighbor island representation and that we have those from our underserved communities as well. So again, this program is online. And we'll continue to be looking for applicants for our community health worker program. We've had hundreds interested there too, but we're continuing to look for more because we really think this is an exciting opportunity and a real career ladder for the future.
So I got about 3 more minutes. Is there anything, Dr. Park, you want to say to our viewers as we reopen? And then maybe 2 minutes, and then I'll give you 1 minute, Dr. Grace.
Yeah, so even before we've been reopening, I've been noticing in our community, a lot of us are feeling more relaxed and starting to socialize, shall we say, more instead of physical distancing. And I think even now we are starting to see some of the numbers rise in terms of cases. And I don't want to say that in terms of as an alarm, but more as a reminder that, unfortunately, this is the new world. This is the new normal, is in that there will be COVID cases even before we reopen. There will be definitely more COVID cases as we do reopen. Number one, our community should not be alarmed by that. It's expected. But it also, number two, is a reminder for all of us that all those safe practices that we've been recommending, the physical distancing for those, physical distancing with those outside of your bubble, outside of your day in, day out persons that you're always interacting with, whether it's your Ohana bubble or your work Ohana bubble, those are things that we need to think about. Physical distancing, the masks, when you're in crowded settings or potential to interact with people, again, outside of your bubble, wear those masks because data is showing it does help. So it's something to think about. And then hand washing, and then not touching your face with dirty hands, and then sanitizing surfaces. And by the way, on that last one, the cleaning frequently, we're not saying like go around with a wipe and follow everyone around and wipe constantly. I mean, that's not what we're saying at all. What we're saying is more daily cleaning. I'm sure there are many of us who have been guilty of not cleaning our surfaces maybe for weeks on end, and saying, oh yeah, I'll get to that. But really what we're saying is cleaning those frequently touched surfaces on a daily basis, and obvious spills. Nothing more than that. We're not talking about suddenly chemicals everywhere and cleaning everything up the wazoo. So things within reason, but again, safe practices, especially as we open up.
And I'll put a pitch in because you didn't say this. If you're sick, stay home.
Thank you. Well, I guess I'm assuming that, so maybe I shouldn't assume that. So,
Dr. Grace, you want to say anything last about UH contact tracing? Is really an amazing program. Thank you for partnering with DOH.
Yeah, no, I really, again, want to thank Dr. Sarah Park and her team. This has been a really wonderful collaboration with the Department of Health. And I have the privilege of leading the U Healthy Hawaii initiative, which aims to leverage the UH system to improve health and healthcare in Hawaii and the Pacific. And we're excited that this program can be part of it. We're also really excited to partner with so many of you in the community, our colleagues at HPU, at Chaminade, and again, across the state and on our neighbor islands. So if you're interested in hearing more, please email us at oshi@hawaii.edu and oshi@hawaii.edu. Thank you.
Thank you, Dr. Grace, Dr. Park. Love to have you on this show. As they're transitioning out and Representative Brower is coming in, I'd like to ask Olelo to just flash on that map. You know, Hawaii is one of 14 states that is partnering to bring up this contact tracing program. And I personally believe it's really important because as we partner, we're really surging from within, and that is allowing us to make better use of our resources. And as you can see from the program that was described by Dr. Grace and Dr. Park, we really are upgrading the skills of our community and strengthening our healthcare network statewide. So with that, I mean, you know, again, I think Hawaii is in the right place, partnering to build up its contact tracing program. I'd like to welcome Representative Brower as my guest, my legislative guest. Representative Brower and I entered the legislature together in 2006. So he has a fond place in my heart. I'm particularly interested in talking to him because he hails from Waikiki, where the heart of tourism has essentially come to near standstill. Although residents are now experiencing less crowded streets, they are also feeling the economic impacts of unemployment. So welcome, Representative Brower. Good to have you here.
Hello, Hawaii. How's everything next door in your office, Della?
We are physical distancing. That's what's important, Representative Brower. So
We used to not do that.
we will get back to being more in person on June 22nd, Representative Brower. So tell me, for you, what has life been like for residents in Waikiki for the last 2 months?
Well, the sad part is that we don't spend as much time together. When I got into my elevator this morning, people were in masks. There was a family, and they physically moved from me. They used to move from me anyway before this, but now it's because of this sad pandemic. And I do a lot of walking through Waikiki. And what's also sad is that it's just like a ghost town. There's not many people. I find more locals and more people in the surrounding neighborhoods to Waikiki because the hotels are empty. The lobby doors are actually locked and closed. So it's just a very strange feeling.
Are you seeing more activity as we kind of move from stay at home, safer at home, act with care?
There's a lot more activity in the last few weeks. And I say with a little bit of a smile, it seems that the protesters have ended the COVA thing because I'm seeing people everywhere now. And when I walk along Waikiki Beach, as well as in our city and state parks, there is much less distancing, especially with young people. So they seem to have made a conscious effort that we are going to conduct our lives like this. So that makes us sometimes a little more anxious, or we have to pay a little more attention to what's going to happen with the virus and if it's going to be contagious, or hopefully that it's not.
So, you know, in our previous speakers, they talked about contact tracing, they talked about good hygiene. What are your thoughts about some of the things that the state can do to help contain COVID?
I think that the state just needs to set the right example, and then we have to hope that people follow. So we want to have rules, we want to have laws in place, but we hope that we never need to use them. So I think for myself is that I follow the rules of the state or the rules of, let's say, a supermarket or a restaurant that I go into. So I wear the mask when I'm at the Capitol. I wear the masks in the hallways. And when I visit an office, I wear the mask there out of respect for their staff. But as you can see in my office here, I take off the mask. So for the most part, I want to respect law and order and then pay attention to what government is doing.
Yeah, and I want to touch on that since, you know, you mentioned the protest and young folks going out and maybe relaxing too much. But in my observations, you know, I thought that some of the protesters over the past weekend, you know, were really good. Clearly, there wasn't physical distancing going on, but at least it was in open air. Masks were being used. I mean, so you, like you said, you walk around quite a bit. And you mentioned maybe in certain places, not as much physical distancing, but what's your feeling about other places? Have you seen do you think people are trying at least?
Well, first, let me say that I vaguely remember what it was like to be young. So I understand what they're up to. And I'm at the state capitol during the rally, and thank you, protesters, for not burning down the Capitol. But to the credit of many people, they did have face masks and they were very polite. What I've noticed, and I'm very touched, and in some ways it's kind of cute, but when I walk down the sidewalk, people get out of my way, I get out of other people's way, and it's not like a rude thing. Like a few months ago, if I was walking down the sidewalk past someone and I made a conscious effort to move away from them, they might sort of interpret that as me looking down on them. But today, everyone knows the reasons behind it. And I think that we're going to just have a lot more of a cleanly society, which is great. Because I'll just share with you, my hand washing habits haven't changed with COVID. I was a little bit of a germaphobe all my life. So I'm glad that my friends now have caught up to me.
Well, we certainly have, Representative Brower. I want to shift gears just a little bit. So it was announced yesterday, we're going to be reconvening session on June 22nd. What would you like to see emerge as priorities when the legislature reconvenes?
Well, first, I think that we want to listen to our constituents and their needs. At the same time, we may need to show leadership and be on top of issues that they may not be aware of. So I appreciate you and members of House leadership meeting with the committee chairs to figure out what doable legislation there is. At the same time, though, because of a loss of tax revenue, we have to be very careful. So if the legislature is able to provide funding for individuals and families in need, we need to do that, but at the same time be conscious that we may not have the funding that we anticipated a year ago. And then as the Housing Committee Chair, we're going to look if there's any non-fiscal bills that might make sense that can keep the flow of affordable housing going.
Yeah, so on that note, we started the legislature with such high hopes. I personally was super excited by our majority package that had in it things with dealing with income inequality, early learning, affordable housing. So as the House Housing Chair, what are some of those non-fiscal things you think we can continue to do? Or are there some fiscal things that we can do to stimulate construction of affordable housing?
Well, one thing that worked out well so far is recently we did pass one of the largest housing appropriation bills in the history of the state of Hawaii. It was about $570 million for an omnibus package. And it's good, and we're lucky that we did this prior to the pandemic. We did it about a year and a half ago, so I'm happy about that. Right now, I think we want to look at the nuts and bolts and, how are we going to maintain the inventory of housing? And then what can we do maybe to spur more housing in private development? So it could be tax incentives in the private sector, and then just in state government is maintaining what we have now.
So I want to apologize to our viewers. I missed some of the questions, but we will try to get to those questions and maybe answer them offline. I don't see any questions or I don't see anything being sent to me at the moment. So I'm going to give you the last word, Representative Brower. Thank you for this conversation about what's happening at the Capitol, about what your priorities are, how we might be able to continue to keep our eye focused on affordable housing. I'll leave you with any last comments that you want to make to our viewers.
Well, I just appreciate you giving me this time, and we need to stay positive. And I just want to say to our constituents in Waikiki, if they can hear me say, I'm standing 6 feet away, I got my face mask on, could I sing you a song? That corona social distance puts a cramp in my existence. It's your hugs and kisses are the things that I misses. So with contact tracing, we'll flatten the curve for now, shelter in place till they give you the word. Are you asymptomatic or pre-existing conditions, false positive test, nervous fetal position? In your role as a leader, Della, make measured decisions because the brave new normal was open for business. Embrace happiness, sorrow, as if no tomorrow. Time is precious on earth till your last day from birth. So let's wear our masks for a while, and behind it, a positive smile.
Thank you so much. Representative Brower, this is why I love you. Thank you to all of our guests today, Dr. Aimee Grace, Dr. Sarah Park, for joining me on this episode of Talk Story with House Majority. It's more important than ever that we stay connected and informed during these uncertain times. If you're new to the show, please follow the House Majority on Facebook, Instagram, and Twitter at High House Dems for most recent updates and future episodes. You can also visit our website at hawaiihousedemocrats.com, which has resources, press releases, and valuable information on how the House Majority is responding to COVID-19. Please stay safe, stay healthy, and stay informed. We'll see you next Wednesday to Talk Story with House Majority. Aloha.